Let's open up our books to chapter 4, neurologic diagnostic procedures. So as always, with our subject, turn on the lights in the back, please. With our subject, we always start with the diagnostics, like how do we assess, what kind of tests are done, what are we trying to assess? Chapter 4, Neuro diagnostics. Yeah, chapter, the unit is only 8 units.
Unit 2, chapter 4.
Yeah, chapter 4.
My favorite eraser. This was my eraser in high school. Look at the mark.
South Beach You understand? Alright, let's start. Let's do the first thing I want to cover with you, because this we will be quizzing on, right? First point, go to page 27. Go to page 27, and you will see a module called the Glasgow Coma Scale. And this is usually abbreviated as GCS. Okay? So, Glasgow Coma Scale. This data collection tool concentrates on neurologic function and is useful to determine the level of consciousness and monitor response to treatment. The Glasgow Coma Scale is reported as a number that allows providers to immediately determine if neural changes have occurred. GCS scores are helpful in determining changes in the level of consciousness for clients who have had head injury, space-occupying lesions, or cerebral infarctions. Encephalitis is important because complications related to neuroinjury can occur rapidly and require immediate treatment. So considerations. This is what I need you to know. Under considerations, look at the fact that it says they're calculated by using appropriate stimuli and then determining the client's response in 3 areas. That scale is what you need to know. There is 3: eye-opening, verbal, and motor. Now this scale is very easy to do, because look at the top ones. Eye-opening. So you give them a score based on what the patient does. So when it says opens eye occurs spontaneously, that means without any stimuli. So for example, right, like if we just let you sleep and no alarm or nothing, eventually you will wake up, right? You try to take a nap, but then right, your eye movement is spontaneous, you just open it, regardless of stimuli or not. You're able to open and close your eyes. Now 3, eye opening occurs secondary to sound. So when there is certain stimuli or sound, they'll open their eyes because they hear something, right? They don't just regularly do it. 2 is to pain, and 1, eye opening does not occur. They don't open their eyes regardless. B, verbal. The best verbal response, with responses ranging from 5 to 1. 5, conversation is coherent and oriented. This is like you and I, we are able to carry a conversation. I ask you a question and you answer appropriately. Okay? 4, conversation is incoherent and disoriented. While they are speaking to you, right, it could be like, are we gonna study for tomorrow's quiz? And then you are like, the car is outside and one is black, and right, like as unrelated to what we are talking about. Or again, it's not coherent. They're not able to make sense about it, like about what they're saying. 3, words are spoken but inappropriately. So this is more random, right? Just basically garbled, right? It's like, we're gonna take a quiz tomorrow. Do you know where you are, right? And it's like windows, doors. And you're not even making a sentence. It's not coherent. It's just random words, inappropriate. Like it's not appropriate to the situation. 2, sounds are made, but no word. Mumble, garble, just yelling, or a sound, groan, right? So you hear sound, but it's not a word. Just notice. And then 1, they don't vocalize at all. Motor. 6, they are followed, commands are followed. Raise your arms, raise your arms, right? Close your hands. 5, local reaction to pain occurs. So they don't follow commands, but should you pinch them, right, or poke them somewhere or something hurts, they will reach for it. They'll react. Okay? So they react to pain. Or they don't even have to reach for it. The fact that you pinch and squeeze them and they will try to, right? They'll move at that point. And they have like a response. Some of them will contract at that point. 4, general withdrawal from pain. Okay, this is where again, pain, and you'll see them is that they just can either pull. So 5, to make it more clear, it's not like a contraction, but more that they try to reach for the painful stimuli. Think of them like trying to, that they know something's there. While 4, while they don't reach, they will move away. They'll flinch. 3, the corticate posture, adduction of arms, flexion of elbows and wrists is present. The corticate is this one. When you see them lying right there in bed and they're like this. Usually their arms come inward. And they usually twist the wrist in a bit. It's what you guys call contracted. Now remember, contraction doesn't have to be from posturing. It happens just regardless, okay? So if, for example, you see people in wheelchairs, right? If they're always sitting in the wheelchair, what happens to their leg? And it's always pulled up, right? If you try to straighten it out and they're always in the chair, especially when they recently lost like their leg, especially if you have amputation, the contraction is just a muscle stuck in a constant pull. That's a contraction. But this, right, what I'm describing, the corticate is posturing. While they are contracted because now the muscle is naturally just doing what? It's just pushing, it's pulling like this. So they do become contracted, but the posturing is from lack of cerebral brain function. Yes?
So the contraction is more like a physical, but this is more like the
right, a neuro. The posturing, their arms naturally coming in like this, is from lack of brain function. Usually at a lower level, from the brainstem below. And then the next one is higher. They've lost more brain function. So the stiffness occurs from just the fact that they're always pulled, but the fact that they're posturing, that they, right, without thinking about it, they're just doing this, that posturing is from the brain function. Now the fact that they're constantly doing this, they will eventually become contracted.
Mr. Armando,
But this is reversed.
are these the postures from a stroke?
It can happen from a stroke or brain injury. So decorticated decerebrate posturing, remember, is from lack of cerebral brain function. So you have impaired or lack of cerebral function. That's posturing. Now this can happen from stroke, because in stroke what's happening? No blood flow, that part of the brain begins to die. But this can also just happen from trauma, and just also disease and disorders. And where you have like disorders that eat away at your nerves. Okay? People who end up nearly drowning,
Yeah.
right? They have hypoxemia or a hypoxic brain injury. This means they didn't have enough oxygen for a while. Kids with heat stroke. So it's due to brain injury, again, lack of brain function. So whatever caused that, there's a number of reasons. It could be trauma, it could be not, and sometimes some recover. Usually young people. From strokes. Usually, so you can think of it, the reason why the younger side recovers and not older, you can think of, right, like your brain is just a series of connections. Now, you've seen that if you practice something, what usually happens?
Becomes easier.
Becomes easier because your brain will
Form new pathways.
imagine that, yeah, you're forming this way, right? And there's all these intertwines. Your brain will eventually, at first, to perform an action, you might follow this pathway
These three
that
postures
comes down here,
is due to lack of
and
cerebral,
finally, right,
cerebral
like in
function
here.
or impaired
But
cerebral.
instead of doing that neural pathway, your brain will form a new one, a shorter pathway. So that you're able to
Brain.
react easier or perform the function. So
This
when you
is-
have a stroke, you can think of all of this, with the blue, right, is lack of function. You can think of all of this as beginning to die. So this area of the brain can begin to die. So then what your brain will do though, is begin to form another function, another pathway. Now, younger people are easier for them to begin to make these formations because their brain is still developing, okay? But an older adult, it's hard to recover from stroke. It's hard to see improvements because the brain development is just not there anymore, okay? But some do recover. Yes.
Something I think is like with the younger versus older they more adjust rather than recover.
Right. Well, the younger ones, again, begin to recover. They'll begin to actually make progress. The older just kind of, like I said, they conform, they adjust to the disability. Okay? So an example of this is, I was gonna tell some story of my brother. My brother had a stroke at a very young age. Technically, he had an aneurysm, and then he had surgery to fix it. And after the surgery, our risk factor is you can have a stroke. And then 6 months later, he had a second stroke, and the second stroke really, really debilitated him. He was wheelchair bound for about a year or so, if I remember correctly. And then, where they were at was in New Bedford, which is about an hour outside of Massachusetts, hour and a half. So getting to therapy was a bit of a problem. He lived with my sister at the time. So then he moved here eventually after a few years with my mom, and over there it's his nose for like about a quarter of the year. So you don't want to be out and about, you're not gonna be outside, you're in a wheelchair and they live with stairs. And so my point is this, he was very sedentary the first couple years after his stroke. Then he came over here and he gets CNAC, USC, right? Ramon is like 2 miles away. And he goes to therapy more, he was starting to go to therapy more often. So when he came here, he still struggled to try to like stand and walk with the cane. And eventually he could get around with the cane quite well. And now he doesn't need it. He walks, like you can see the weakness on one side, but he walks. And he doesn't need it, he goes upstairs just fine, like he gets around more than fine. The only thing that didn't recover as much function was his left hand. He can't really grip with it, it's again more like a tractor. So, he was 21, 22, right? He's about, he's like 34 himself. So it's been a while, a little over 10 years. But you saw the progress, hence as he developed. So in any case, we'll go over this more in detail. For GCS, the last thing is they'll develop posturing. Now, the cerebrate posture. This is the one where they have abduction of arms and the extension of elbows and wrists. So in this one, you'll see that some patients and subacutes are like yay, but in the cerebrate, it's when they have them down here at the side usually, and they're kind of pushing outwards almost, kind of the bed keeps them in place, so you push outwards, and then the wrist goes this way, right? So they're usually like this. And their feet will drop. Yes?
So for visual, 3 is this way.
3 is like this, and 2
Is that way.
down.
Okay.
Very minimal brain function, a lot of impairment. They're essentially not there. The body is alive, but brain function is very minimal to them.
It's just like a
Almost, just about. I make you guys cry and watch an honor walk. I nearly did, but I toughed it out.
do it.
An honor walk is when a patient is gonna donate their organs because they're dying or are brain dead. The one that they show us, as Job was a child, a 10-year-old little girl. It's very touching. I thought it for
Another child
One thing.
Ito 3, ito 4.
Look at the numbers again.
Asan?
That's your first one, sorry.
the better organ, yes. Now,
No, it goes from height.
specialty, I'm sure there is a point where it's too small. It's not gonna work well with the function, yes.
They just trying to use another child
Yeah,
usually.
yeah, exactly. So at some point there is and again, a doctor will evaluate how much cardiac output is realistic to sustain the next candidate. Because cardiac output, right, will be stroke volume, which is how much blood is being pumped out, as well as heart rate.
They're founding the picture.
And so a smaller heart will not deliver the cardiac output.
Maybe not smaller, but what about younger? Like, if it's a younger part, would you be looking at like a better?
GCS will roll out is like this.
Rolo.
So, patient is lying in bed. Let's say it is a trach patient, right? And so you'll see, and you go, and you're like, right, you say, I'm here to do an assessment on you. And you like touch them, right? You talk to them at first, no eye opens. You move them, and when you move her eyes open. So what would you rate?
Would it be,
right there.
would it be acute? No. Oh,
Okay, what did I say?
You said you.
Touch.
yeah. You touched it, right?
I told her to wake up, but she didn't. But when I moved her, she opened her eyes.
But I was trying to pain, right?
So it's the same pain or to stimuli? Oh,
It's just pain.
The pain, because I had to touch her, right? I had to move her. 2, verbal. She opened her eyes and looks at me, right?
1.
Hi, how are you doing? She doesn't respond. Right? And then I tell her, I'm like, can you raise your hands for me? Can you squeeze my hand? Squeeze with your arms? Nothing. Right? I pinch at her hand, pinch at her feet, nothing happens, right? I pinch at her stomach, and her arm moves towards like her stomach when I pinch her.
Is that force generally the draw?
No, she reaches for it when she feels a pain.
5.
Alright, she localizes pain. Now, let's say that she didn't reach for it, but she just moves, right? So I pinch her stomach and she'll move away. General withdrawal from pain. So then she would be a 4. And then you just add it up. So 2, 3. Severe head injury, right? Like head damage. And when they're 8 and below, they are generally 8 and below. They can't do anything for themselves generally. That's like a cutoff. 8, and I need you to remember that. Once they're 8 and below, severe impairment, and generally they're total dependent. It's a fast, like I said, it's a fast track way for a doctor to know once they're 8 and below, they're severely impaired. Thank you. That was gonna be my next point. Say, what's your lowest score? Possible.
3. 1 more.
3. People always say 0. But for anything you can't do, the worst you can do is 1, 1, 1. 3.
0.
Complete brain death.
For the motor, you're saying like pincher, shimmy, stomach should react. So how's that? Like they don't feel it as much in a certain
They
area?
might not feel it, yeah. Or they don't reach there, or it's not painful enough.
Less than
We are on page 27.
less than 8.
Or semi-comatose. You can also say like a semi-vegetative or semi-comatose state. Once they're like, I think, like 4 or 5, I think it's 5, they're considered like it's a coma. Or D, they call it, there's a differentiation between deep and like a semi. Yeah, deep for sure, but I think even by 5 it is like, there's no eye response, there's no verbal response, but they like generally withdraw, or again, they're just decortative, they don't have any response, they're in a coma. But again, you see, they're still posturing, they have a 4 or a 5. But they're already, I think 5 is the cutoff. If they still open their eyes or groan, semi-comatose. So 8 is semi, I think 5 is the one for deep. But the one that I need you to know is 8. Once they're 8 or below, it's just, it reflects severe brain damage. As long as you know that 8 and below is like, that's a nice cutoff.
And 3 would be someone in a coma, right?
3 is complete brain death. But from 5 and below, you're already in a deep coma. Now it's funny, yes.
What about like, so 8's like a severe, what if it's like less than 8, like a mild head injury, or like moderate?
It doesn't matter how bad their head injury is. You're measuring based on the scale their brain function.
Oh yeah, no, I'm saying, so at 8, is there like different, like, from here to here is for this one, here to here is for that one?
The overall score is taken into account, because I see what you're saying, like, it's like, what if it's 8 but they still talk
No,
to me?
no, I'm saying like, what if it's not 8, what if it's 10, it's still like,
Oh, then yeah, there's still a lot of function there. So for example, like I see people that, yeah, they either are confused, all they are is just confused, they're like a 14 or a 13, depending if they're not even making sense, they're just saying random stuff. They're a 13, they're just confused though. Or again, they could be like a 13, 12. They don't listen to you, right? Like raise your arms, right? They're not talking to you. But again, should you like, the moment you reach for them or anything, they like react to the pain. They feel something, and they're just confused. They're like a 12. So, and just, it doesn't say it's a mild injury, but on the GCS, they're still at a 12. There's a lot of hope for recovery. Once they're 8 and below, it's difficult. From like 10 and up, there's a lot of hope for recovery. They just might be confused. Yes? It's funny when people are kind of like out of it or whatnot, and I seen a coworker do it a long time ago, and I haven't had to do it until recently, because like, people be tripping, you know, like, there's one lady who was throwing a fit, and so she wasn't really responding to anything I said, and I would move her, and so then how do you check to see if someone is truly like, not there? It's sternocrumum. It hurts, you know? And I'm not talking about don't like, you know, you're like kind of knock. You gotta like, you know, get in there. And to one of them, it's funny because some of them when they're playing, their reactions are like priceless, because like, you're like, ah, like, they're like, ah, what are you, like she reacted to me like, what are you doing? You know, like, why are you pretending to be this? I told her, I'm not sure if you're knocked out or not. She's like, no. She's like, I'm not listening to you. She was all mad.
Selective.
But I started rubbed her, and I had a charge nurse one time. She was